of Disease Control and Prevention, where we provide updates and information as well as take your questions to provide more clarity on issues regarding pandemics on the continent. We have previously really focused on the COVID-19 pandemic, but for your information, we have now included many other issues that are of concern to the continent. And in this regard, we will be introducing a guest speaker to speak on one such challenge. But as usual, we are joined by the Acting Director of the Africa CDC, Dr. Ahmed Ogwell. And my name is Wayne Musabayana. I'm Head of Communication at the African Union Commission. And our guest today will be coming from the Africa CDC as well. And his name is Dr. Mohammed Abdulaziz. And he will be talking to us very briefly about neglected tropical diseases. And as usual, after the briefings of Dr. Ogwell and Dr. Abdulaziz, we will then go into our question and answer section, during which we will request you, as you ask your question, to identify the question is addressed so that you can get the best possible response. We are coming through to you in English and in French. And for that Q&A, please utilize the WhatsApp number +251 94 550 2310 +251 94 550 2310. We also welcome your questions on this platform, either live talking to us or through the question and answer section. All right, let's now go into our briefing. And first, let me invite the Acting Director of the Africa Centers for Disease Control and Prevention, Dr. Ahmed Ogwell, for his briefing. Ahmed, it's over to you.
Thank you, Madam Wayne, and good morning, good afternoon, good evening, colleagues, wherever it is that you're joining us from. Today's briefing, I would like to start by covering the major public health events that we are actively responding to. Last year, if I may give a little bit of background, we documented just over 120 different outbreaks on the continent of Africa. We had about 21 that were public health events of concern, and we actively responded to 10 of them due to the complexity of those of public health emergencies and disease threats. And all these fall under the ambit of Africa CDC. And when we report on a few, it is because those are the ones that we are most actively responding to, but there are many others that are there in the background. So today speaking, there are about 9 outbreaks that we are following up on the continent. The 5 are COVID, a new flu-like disease that we have not yet characterized, diphtheria in Nigeria, monkeypox in multiple countries, and cholera also in multiple countries, before giving way to Dr. Mohammed Abdulaziz to speak to us about neglected tropical diseases. On COVID, as of today, 12.2 million cases have been documented on the continent of Africa, and this is about 2% of all the cases globally to date. We have also, unfortunately, experienced 256,567 deaths as a result of COVID over this period of the pandemic, which gives us a case fatality rate here, the global average. The deaths that we see on the continent constitute about 4.1% of all the deaths across the world. The good news is that no new waves have been observed across the continent. Indeed, we have not seen any new variants currently actively doing surveillance for variants and subtypes. And as last week reported any new, when we look at the trends over the last 1 week, and 68 new cases have been documented, and this is a 40% decrease when we compare to AP week 2. So the numbers have gone down over the last 1 week. When we look at deaths, we have documented 29 deaths during this AP week 3, which